Bismillahirrahmanirrahim. I am Dr. Amjad and I'm working as professor and chairman Department of Medicine in the Bacha Khan Medical College and its attached teaching hospital Mardan Medical Complex. Today I have been given the opportunity to talk to you about a very common problem, and that is asthma, which is very prevalent in our country due to recent pandemic COVID. The asthma has been intermingled with COVID, but it has a distinct entity in itself, and we should not confuse asthma with other diseases. And we have some clinical parameters and some investigations through which we can differentiate asthma from other disorders. There are genetic factors and there are some environmental factors which are involved in the asthma in patients. This season, we see limited number of exacerbations of asthma, but as the weather gets colder from September onwards, we will expect to have exacerbations in asthma. And people start coming to hospitals, to clinics, and to healthcare facilities for their exacerbations and for treatments. We can classify asthma into a few categories. It's intermittent, then it's mild disease, then it's moderate, and the severe forms of asthma which require hospitalizations in some situations. Intermittent are symptoms which occur intermittently, obviously, and there are limited variations in the FEV1, which is a parameter and a test that is performed by breathing out in a machine, and which tells us if the FEV1 is 80% or less than that or above that. If it's around 80% or above, then it's an intermittent disease, which can occur especially at nights, in the evenings, or early in the morning. And if FEV1 or peak expiratory flow reduces or comes down to less than 80% and more than 60%, it's a mild disease. If it's come down to less than that, it becomes a moderate or severe forms of the disease. Asthma can be easily managed. Many of the guidelines from around the world, that's British Thoracic Society, the American societies, or the GINA guidelines, which is a global initiative for asthma control. So all these will tell you about the inhalers. So the mainstay of the treatment is inhaled corticosteroids in many of the cases, I should say in most of the cases. In milder forms of the disease, low-dose inhaled corticosteroids, if properly prescribed, and the patient should learn how to use an inhaler. Proper technique is a must, and patients must learn how to use the inhaler properly. So most of the patients are controlled with inhaled corticosteroids. In moderate disease and a severe form of the disease, we will combine inhaled corticosteroids with long-acting beta-2 agonists. Now, good products are available in the inhaled forms in which the two are combined, and most of the patients will do well with these inhaled corticosteroids plus LABA, that is LABA, long-acting beta-2 agonists in inhaled forms. The thing is that the healthcare professionals should and must educate their patients. Educating the patients in every disorder is essential to their treatment, but especially in asthma, every time when the patient comes to clinic, they must be taught the technique of the proper use of an inhaler device. And luckily, we have so many devices which are very easy to operate and very easy to use by the patients. And if they follow simple techniques of inhaling the drugs correctly, so many of the patients will be controlled. In most severe forms, when the patient cannot breathe properly, cannot talk properly, their oxygen saturation drops, they will need admission in a healthcare facility. But most of the patient can do as an outpatient treatment. the oral medications, and most of the patients are discouraged because of their side effects. But in the severe form of the disease, we can prescribe oral steroids plus some other medications like leukotrienes, inhibitors, chromones, all these. But you can do, and all the people or all the patients with asthma can do well with inhaled corticosteroids, which are advocated around the world from different societies of the chest, and it can easily be controlled. Patients should avoid allergens, and patients can identify to which they are sensitive, like smokes, like dusts, like roaming around in open air, especially in the spring season or in the autumn season when there are allergens in the air. So avoiding these by adopting these simple measures, and by taking inhaled corticosteroids along with LABAs, and have regular follow-ups with your healthcare provider so that you are well controlled, your disease is well controlled, and you don't get exacerbations. او د عامو کتونکو دپاره او د خلکو دپاره یو دا دی چې دا پریزنټیشن تاسو ګورئ، نو لاندې د یو پټه چلیږي په دې سکرین باندې چې په دې باندې یو هیلپ لاین ورکړی شوی دی. نو که کومو مریضانو تاسو اکیوټ یا ایمرجنسي تکلیف راځي یا سای خرابېږي، نو د دې هیلپ لاین نه په ایمرجنسي کې فایده اخیستی شئ. نو هغوی به تاسو ته ایمرجنسي میډیکیشنز هم وایي، او بیا به ستاسو د علاقې مناسب سره تاسو ته ویم چې کوم ځای کې سپیشلیسټ کلینکس اویلیبل دي، نو تاسو د هغې ته بیا تللی شئ او خپله معاینه کولی شئ. ډېره مننه. Thank you very much for listening and for viewing. Thank you again.